Well, this might be hard to believe, but we are actually approaching the 3-year anniversary of the start of the COVID-19 lockdown here in Illinois. It has obviously been a very long road since then, with a number of advancements, of course, along the way.
Very true. Here to talk more about this and what we've learned and what we still need to remember when it comes to COVID-19 is Dr. Benjamin Imba with Cook County Health. Doctor, thank you so much for being here.
Thank you. My pleasure. Thanks for having me.
Can we get your thoughts on what it means reaching this 3-year mark?
Yes, absolutely. I think when I look back, I reflect on at the outset of the pandemic, there was palpable fear. People were dying. There was a confusion, sense of helplessness. We didn't know exactly how to tackle this virus. And this quickly transitioned to demonstrations of courage, of sacrifice, of empathy, unity, teamwork, especially the healthcare providers and essential workers. And I think the healthcare providers over the last 3 years have given their all to fight the pandemic, and the public support, outpouring of public support has been extremely encouraging. Having said that, it's 3 years now. We've learned a lot over the last 3 years, and I will break it down into the good, the bad, and the ugly, if I may, things we have learned. So on the good side, we have learned that we have developed effective treatments for seriously ill inpatients in hospitals, those on ventilators, that can reduce mortality. We also have effective outpatient treatments for those with mild illnesses who are at risk of progressing to severe illness if they have multiple risk factors. This can prevent them progressing to severe illnesses or needing a ventilator. We have also learned that the vaccines have been extremely effective at reducing serious illness, reducing hospitalizations, and reducing deaths. So that's what we've learned. Now, on the bad side, so the good, the bad, and the ugly. On the bad side, first and foremost, we have lost over 1 million Americans, and that is a very sad fact. Secondarily, we have also learned that there is the concept of the phenomena of long COVID, wherein patients after an acute illness may have psychological and physical symptoms that go on for 3 months or longer. Physical symptoms such as chest discomfort, fatigue, coughing, some shortness of breath, psychological symptoms like anxiety, depression.
Dr. Imba, we're short on time, so I'm going to ask you to fast forward to the ugly.
Okay. Well, the ugly is that we have seen how a pandemic can wreak havoc on the global health systems and economies. And I think it's only a matter of time that there's going to be a new pandemic around the corner, or a new strain that's going to make things difficult for everyone again globally.
Okay, well, that's a very good context. Dr. Benjamin Imba, we really appreciate your time this afternoon. Thank you.
Thank you for having me. Thank you.